Hi, my name is Carolyn and I'm a registered nurse at Bella Glow Aesthetics, and today we're going to be doing a PDO thread lift on my patient Catherine, and we're going to be using a combination of barb threads, smooth, and twist threads to achieve a non-surgical facelift. And so the PDO thread lift and just PDO threads in general are great for all ages, let's just be real, but they're really good for women that don't want to go and do the full surgical facelift with a plastic surgeon quite yet. They might be looking for alternative routes. And most of the women that I do here, I would say with the PDO thread lift, are gonna be in their late 30s to early 40s up to 50s. Anybody over that, if their skin is super loose and saggy, it's kind of risky for me to get in there as well, because there is a more chance of me running the barb like through their mouth when it's really thin skin. So I would probably refer out to a plastic surgeon. So it's really important just to assess all your patients and recognize that for each patient that they should have individualized treatment plans. We're gonna be using 21 gauge barbs to lift her face up. And right now I'm just sterilizing. She has a dental block, so I've put a block of lidocaine throughout her whole entire face. So she's gonna be pretty numb during this procedure. She's a really good candidate for this because she doesn't have super loose, saggy skin yet. And really, we're just trying to pick up her jowl just a tiny bit. So this is some lidocaine with epinephrine. The benefit to this, I know we kind of talked about it, but really just getting that lift, tightening. That's what the patients love. It's a great alternative. So the bevel on these 21 gauge barbs goes down when you go into the skin, because then that's when I'm gonna bury the thread. So once the thread is in, you want to bury the suture and then you want to pull it out like that. We use the barb threads right now, and the reason why is because she wants to lift her face. So as we age, we start to get this little jowl that forms down here, and that's normal because as you age, you lose volume in your fat pad, right? So over time, that happens every year. That's why this is a really good procedure for her. So we're doing 2 threads in the same hole that we made to give her more of a lift. And so then we're burying the thread again, like that. Open. How was that, Catherine? Not too bad? Good, you are easy. This is just lidocaine with epinephrine just to blanch the skin right here. So we need a pathway to get the barb thread into the skin. And this is how I'm gonna create my pathway, is just like that. And it's very normal. Sometimes you might have to poke them twice, once if you're lucky, twice sometimes, it just depends. Sometimes their skin closes up really fast, the little hole. Because the thread, people get confused with the whole barbs. They're not needles, they're blunt tip cannulas pretty much going in. So it's gonna prevent bruising. She'll have a lot of swelling and tenderness. There can be also some nerve pain, but she shouldn't have too much bruising. So with these PDO sutures, they're made of proteins, and as they metabolize over time, they start to stimulate collagen production, and that is known as neocollagenesis. And so it starts to stimulate collagen, so you end up seeing more of a lift over time. And that's what's really cool about this treatment, is every month you see a little bit more and more, and usually by that month 3 is when it's really peaking. And then usually by about 9-10 months, the threads will actually start to break down, and then that's when they kind of want to do it again. So this is something you could do every year if you wanted to, but everybody's different. You just have to kind of look at them, assess them, and see what is best for them. So I'm gonna make my little pathway. So this is like my entry. I make my little pilot hole just like that so I can put the thread in. There's my little pathway right there. So I'm taking another 21 gauge barb and I'm going through the same pilot hole that I created. She has really nice thick skin. See the thread going in? We just want to be cautious of where it's exactly going. Perfect. I'll show you how we cut them. Obviously, cleanliness and being sterile is the most important thing. So I'm always alcoholing, and I'm always using Hiblicans. And now you want to bury the threads, and she's going to feel a little cinching like that. And now the threads are buried. See how I'm cinching? Is that cool? It's pretty cool, huh? And this procedure takes about 30 minutes to do. I do like to give them a block of lidocaine in their face prior, and that takes about 10 minutes to set in. So usually I'll have them come in a little bit early to do that. But you could really get this done like over lunchtime if you wanted to. She is gonna be in some pain afterwards. It's not gonna be like excruciating pain. So there is a bunch of post-care that will follow, and I'll go ahead and go over that with you at the very end of everything. But first I'm gonna go ahead and do the other side. So the bevel on these 21 gauge barbs goes down when you go into the skin, because then that's when I'm gonna bury the thread. Open your mouth. So once the thread is in, you wanna bury the suture, and then you wanna pull it out like that. So somebody that's doing this for the first time, they're probably not gonna do like a whole non-surgical facelift. They're probably just gonna wanna start with maybe like their cheeks, because the cool thing about these threads too is that they stimulate collagen production over time, and they peak at 3 months. So I always tell people, you know, you will see a little bit of a lift right away, but unfortunately you're also gonna get the swelling with the lift right away. But then over 3 months, it's gonna keep peaking. So a lot of girls will be like, oh my gosh, I love the threads that you put in me, because it almost looks like I have some voluma in my face. You know what I mean? So a lot of people don't want a bunch of filler in their face. They don't want a bunch of filler under the eyes. So with threads, we can achieve a similar look without putting the fillers in, because nobody wants to do tons and tons of filler in their face. I always like to start pretty conservative with people just in general, whether young or more mature. It's always good to just have a more conservative approach with anything aesthetics. So this is like my entry. You know, I make my little pilot hole just like that so I can put the thread in. So it's gonna prevent bruising. She'll have a lot of swelling and tenderness. There can be also some nerve pain, but she shouldn't have too much bruising. Open. So I have the patients open their mouth because you don't want to jam a barbed thread into her mouth, you know, because all people have different thickness of skin. So some people have thin skin, some people have thick skin. To always just double check and make sure like what plane you're in. Go ahead and open again for me. This is going to be like a subdermal plane that we're in. It's not going to be superficial, because if it's superficial, you're going to see the thread. And it's not going to be too deep, because if it's too deep, you're going to risk, so they're going to feel it. A lot of people will go like that with their tongue, and then they can feel the thread in their mouth. So you want to make sure you're in the perfect plane with these. So I'm taking another 21 gauge barb, and I'm going through the same pilot hole that I created. Open your mouth for me. And then so you want to bury the suture and then remove. So watch. Pretty cool. if you really want that lift, you're gonna wanna go with a barb thread. The smooth and the twist are gonna be really good to make that mesh formation, like I said. And those are gonna be really good for just like smoothing fine lines and wrinkles. They almost act as like Botox. I mean, it's not gonna be as like an instant gratification as Botox is, like how Botox just kicks in like 3 or 4 days. But the threads are gonna be really good over time because they stimulate lots of collagen. For me, I like to put threads under my eyes because I don't feel like I'm a candidate for like fillers yet under my eyes. So I just kind of like to put a couple little threads under my eyes just for some rejuvenation. So now this is an 18 gauge, okay? And so then we just insert it like this for the little pilot. How are you doing, Catherine?
Oh, I've done a little.
So you always want to feel, you know, where the thread is because you don't want to poke it through her skin, and you want to make sure you're in the right plane. And so we're in the right plane. And so then you want to bury the suture. Perfect. How you doing?
Good.
And now you want to bury the threads. She's gonna feel a little cinching like that. And now the threads are buried. See how it's cinched? And then you bury the thread, just like that. So post-care is really important with this procedure. I usually tell people, obviously, you don't want to exercise, you don't want to do anything with your mouth for a good couple weeks. You don't want to take big bites of an apple or anything like that. So I usually tell people to just do soup for a couple days or like smoothies. You don't want to pop the thread. So, you know, if you open your mouth like that, the thread can pop, and then that's when I have to go in with my ultrasound device and metabolize the thread with some heat and ultrasound and radio frequency. So we don't want that to happen. It's really important that you stay really hydrated with this. Swelling, a little bit of bruising, tenderness is very normal. Sometimes the threads can lay on the nerves. So when I had them done on me, I experienced some nerve pain up to 6 weeks. It wasn't very comfortable, but it was doable. With a little bit of ice on my face, you know, here and there, it felt really good. I usually tell people to stay off the blood thinners as well after this procedure. And then it's really important that the patients understand that when they get this done, that they don't really go back to work on this day because they're just gonna be very uncomfortable. And especially when the lidocaine block wears off, they're not gonna be feeling very well either. It's really important to sleep elevated with this. With anything that I do here, I always recommend sleeping elevated just because we wanna decrease swelling as much as we can. She's gonna go home after this, she's gonna ice, she's gonna chill, she's just gonna like watch a movie, and she's just gonna hang out. Sometimes I'll get people that will message us or call us a couple of weeks later and complain about nerve pain. So I really have to say multiple times to them, you know, you're gonna experience nerve pain, there's threads in your face, they're laying on the nerves, so that's very normal. And then over 9 months, they break down, they metabolize, they stimulate a lot of collagen. All pricing is gonna be different as far as how many threads you want, what kind of threads we're doing. It's in between anywhere from like $500 to $2,000, just depending on how many I'm doing on the person. And we love doing this at Bella Glow Aesthetics. And if you wanna check out any more of our procedures, you can go to bellaglowaesthetics.com, or you can check out our Instagram page as well, which is Bella Glow Aesthetics.